Which Asian double eyelid surgery do you recommend? I'm in the middle of doing research about Korean eyelid surgeries and want to get a procedure done to enhance my eyelids. At the moment, my eyes are asymmetrical, and I wish to have more defined double eyelids, more longer eyes so that it is less circular, and symmetrical eyes. Which procedure do you recommend? Also, do non-incisional eyelid surgical methods require removal of stitches after surgery?
Thank you for your question. You submitted a single photo and you stated you're doing some research in Korean eyelid surgery and that you want to improve the symmetry between your eyes. And you want to know, of course, what's the best approach. And you asked at the end of your question on whether or not it's necessary to remove sutures after non-incisional eyelid surgery. So certainly I can help you with these questions. I'm a board-certified cosmetic surgeon. I'm a fellowship-trained oculoplastic or oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And I specialize in Asian eyelid surgery. So I can give you some perspective on how we would approach a patient like yourself when people like you come to our practice. So let's begin with the differentiation of the two methods of Asian eyelid surgery. One is called incisional, one is called non-incisional. Non-incisional procedures, which I think I'll stay focused on for you because I think looking at your photos, I don't see any evidence of a significant amount of skin, but non-incisional procedures are still require small incisions. There are little openings made in the skin, and through the skin, stitches are placed, and those stitches engage the skin with, or I should say, attach the skin with the levator muscle. The levator muscle is the muscle that lifts the eyelid. It's what is responsible for causing a crease. When people are born with a natural crease, it's because the levator muscle has natural fibers that are attached to the skin and muscle in the front that creates a crease. Surgically, we create that crease by using sutures. Now, the difference between a non-incisional and incisional is that with an incisional operation, we are removing skin. It may not be a lot of skin, but it is still about removal of skin. And so that type of surgery, we're still also engaging the levator muscle to attach to the skin. Now, as far as the question about removal of sutures with the non-incisional method, you don't have to do that. The non-incisional sutures are actually permanently placed inside the eyelid, so they don't have to be removed. The skin just kind of grows over, and most of the time it's not an issue. This is an important thing to understand, and it also has an appeal because a lot of times the amount of swelling is considerably less after non-incisional Asian eyelid surgery. Short term, there can be swelling for both methods, but the swelling appears to go away a little bit faster with non-incisional surgery. Of course, there are always exceptions to that. So I think that you should meet with qualified, experienced cosmetic surgeons very familiar with Asian eyelid surgery to figure out what's the best choice for you, non-incisional versus incisional. But I think you're on the right track in terms of your research, and I think once you meet with a doctor that you feel is right for you, you can move forward with trying to achieve the symmetry that you want to achieve. So I hope that was helpful. I wish you the best of luck, and thank you for your question.